Thank you. Next slide, Takina. Hello, everyone. Welcome to the MTP Public Forum. This is year 2025. We're happy to have you. We are recording this webinar, and for that reason, we have muted all attendees. Another option we have is communication access real-time translation. So those are CART services. They are available during this webinar. I've just added the link to the chat. The chat feature is disabled for this webinar, and so the CART services, you'll see that link. You can join that way, but you will not be able to respond in the chat. You can also use closed captioning, so that's the little CC icon that you see there. You can turn that on and off in the toolbar. We have a questions feature, so that's the Q&A at the bottom in the toolbar as well. Please submit your questions that time through the toolbar feature, and then we're going to save our questions to the end. So add anything there, do not, or you will not be able to add it in the chat. So if you see that Q&A at the bottom, that's the icon to click for questions. We at HCA, we do not allow artificial intelligence note-taking apps, so we will kick any of those out of the meeting if we see them. And once this presentation is over, we've recorded it, we will be adding it to the MTP meeting and materials webpage. That link is there. And I will also share that later on in the meeting. Right now, I'm going to add the link to the presentation to the chat, so you should be able to see that too. If you're not able to follow along on the Zoom, you can click on that link and you'll see the presentation. Okay, next slide, please. This is our agenda for the meeting. As you can see, it's pretty packed. I'm not going to go through it right now, but we will touch on each one of these subjects, and we have different presenters here. Next slide, please. These are our speakers for the day. My name is Lindsay Fluharty. I'm the communications manager here for the MTP 2.0. And I'm not going to introduce everyone else because they will be speaking for themselves. And I'm actually going to hand it right over to Kaylee, and she'll introduce herself and kick us off. Thank you.
Thanks so much, Lindsay, for kicking us off this morning. I'm Kaylee Dufresne. I'm the Deputy Policy Director here at the Healthcare Authority. Takina, we can move ahead a couple of slides. So, 2025 has been quite a year, and there is new leadership at basically all levels of government. Obviously, the new federal administration that came in January. We also here at the state level brought Governor Ferguson on board, and a few months ago, in roughly August, September, the Healthcare Authority had a new director start, Ryan Moran. And even me, I'm new to the Medicaid Transformation Project team after Michael Arness retired. So a lot of changes at the leadership level in 2025. And of course, particularly with the federal administration change, we're seeing some shifts and changes in policy, including the passage of HR 1, which we'll talk a little bit about as we think at the end of this webinar today about what's ahead in 2026. But even through all of that change, the core team at the Healthcare Authority has been strong and consistent and saw some major achievements in calendar year 2025. We're going to talk about a few of those today. In particular, we'll give kind of a high-level overview of our Medicaid Transformation Project 2.0. We'll talk a little bit about the reentry initiative and the progress we saw there. We'll talk about health-related social needs, where we are in implementing some of those HRSN services and where we're going in the future. And then we'll do that look ahead that I mentioned, plus a couple of other small topics on our Community Information Exchange program and our Contingency Management program. So with that, I'm going to turn it over to our MTP Director, Emma Oppenheim.
Hi, everybody. Happy Monday. MTP Director Emma. Next slide, please. So I'm just doing a little bit of background on what the MTP waiver is. So it's Washington's Section 1115 demonstration. And what is an 1115 waiver? So it's a way to test new programs for Medicaid. And so according to the federal government, our programs have to be budget neutral, which means that we can't spend more money than we would have otherwise under standard Medicaid rules and regulations. So I'll just do a little quick overview of where we're at with our timeline. So in 2024, in the summer, we transitioned from MTP 1.0 to 2.0, and we've continued a number of programs from 1.0, and we'll talk more about that on a following slide. Then this year in 2025, we've made quite a lot of progress launching some of our HRSN services, as well as our reentry initiative in the summer. And Tyron's going to talk more about that. Then in 2026, we're looking forward to continuing the reentry work, launching additional facilities, as well as launching some more HRSN services. And we're excited about that, and we'll talk more about that. And then in 2027, we expect to continue our programs, really collect data to show the evidence of how it's going with these programs. And then in 2028, we'll produce some final reports. And then the waiver is scheduled to end in summer 2028. And there will be some renewal activities that we'll be engaged in over the next few years as well. Next slide, please. So just a quick summary of some of the programs that have continued from MTP 1.0. There's the mental health and substance use disorder IMD programs, continuous Apple Health coverage for children. So that's for children ages 0 to 6 and for postpartum coverage. And CMS has actually communicated to us that these programs will end in summer 2028 and will not be renewed. And we can answer more questions about that today or via email. And then we have our programs for older aging adults and family caregivers, so our MAC and TSOA programs and our LTSS presumptive eligibility program. And then, of course, there's our supportive housing and employment program, foundational community supports that continues to be up and running, and I think we'll be talking more about today as well. And so we actually do have an evaluation report that is live and has been posted both on the federal Medicaid website as well as on our website. And you can take a look at that to review some of the evidence of what we found from these 1.0 programs. Thank you, Lindsay, for sharing that link. Next slide, please. And so we have a number of new programs that have launched or are in the process of being launched over the last year. We're really excited about all of these. Again, Tyron's going to talk to us quite a bit about the reentry initiative, which got off the ground over the summer. We have a number of health-related social needs services that formally launched this year or are very much in the process of being launched, including our community care hub work. And then we actually made great progress as well in our community information exchange, including a procurement that we'll talk a little bit more about later today. And we've also been making quite a bit of progress on our contingency management program, which is for substance use disorder treatment. And I'll talk a little bit more about that later as well. So just a little overview of where we're at. And then I'm excited for the team to dive deep and talk more about these different programs. Next slide, please. I think I'm turning it over to Tyron.
Hey, great. Thanks, Emma. Good morning, everyone. My name is Tyron Nixon, and I'm the Transformation Implementation Manager within the Medicaid's Program Division here at the Healthcare Authority. And my purpose before you today is to update you on the Reentry Initiative and some of the amazing work the folks at HCA and partners have been involved with. So serving as a foundation, Washington State was the second state in the nation to have our 1115 waiver approved. And the approval occurred back in June 2023. And so the question on the floor is, why is this second in the nation 1115 waiver approval important? Well, it's important because beginning July 1st of 2025, Washington State's Medicaid program, or Apple Health, will pay for a targeted set of pre-release services for Medicaid eligible adults, youth in Washington State prisons, our jails, and youth correctional facilities within 90 days of release. And so the objective is really to facilitate access to essential healthcare services and case management to enrollees while incarcerated and allow beneficiaries to really establish relationship with community-based providers from whom they could receive services upon release to the community. So participating facilities, I'm going to say, if you look at the graphic here, participating facilities provide clients with 5 mandatory reentry benefit services. And as you can see from the screen, those services are reentry targeted case management or RTCM, substance use disorder, pharmacy, medication at release, pre-adjudication, CAA. Eligible clients are Apple Health Benefits, post-adjudication, CAA eligible clients, clinical assessment and evaluation. So pre-release services include that care coordination to diagnose, treat, stabilize individuals, to address service gaps that may be in existence, provide treatment to control qualifying conditions, and prepare them for release, including providing behavioral health clinical consultation services focused on mental health. Also, there's the pre-release services which include medication-assisted treatment, so medication for alcohol, opioid use disorder, hepatitis C, HIV, and then again, more importantly, I would say just as important is the 30-day supply of medication and medical equipment at release. So now, if I can gear your eyes over to the right side of the screen, participating facilities may also offer optional services, and that is participating facilities may choose to provide access to additional benefits that can be reimbursed by Apple Health, and those include lab and radiology services, pharmacy, pre-release medication, clinical assessments and evaluations for adults, services from providers with lived experience, and medical equipment and supplies at release. And as we pivot to the next slide, what has been our approach to implementation? And so let's go to the next slide. Overall, our approach has been engaging with implementation partners such as WASPIC, or the Washington Association of Police Sheriffs, of Sheriffs and Police Chiefs, correctional facilities, managed care organizations, our accountable communities of health, and our reentry advisory work group that have been really, really involved with us as we implemented the program. We've launched a capacity building program that requires facilities to describe their existing capabilities, operational gaps, and technical assistance needs. We use the cohort selection and milestone approach. As you see here, the dates and times for those deliverables. Looking at milestone 3, we put into motion a comprehensive readiness assessment process that requires facilities to demonstrate their ability to comply with all waiver requirements before going live with the authorized services you see there. So under this process, I am happy to report that we have 8 facilities that went live July 1 of 2025. And as we look at the cohorts more closely, we have 4 facilities that launched November 1st. There are 4 facilities making progress to starting on January 1 for cohort number 2. And our partners at DCYF are making progress to launch March 1 with Green Hill and Echo Glen. Continuing further, our partners from the Department of Correction plan to phase in their 10 facilities between April and July 1 of 2026. And as we round out the cohorts, there are 20 other facilities intended to participate in cohort 3. So happy to report across all cohorts, we've been able to distribute readiness funding to facilities to support their planning efforts to participate in the initiative. And as we pivot over to the next slide, what has been other highlights for the years? And for the year, there has been many efforts behind the scenes. So working with our implementation partners, again, such as WASPIC, correctional facilities, our MCOs, our ACHs, or our accountable communities of health, several implementation subgroups were formed to work on various aspects such as facility and provider readiness, pharmacy, provider enrollment, contracting and credentialing, care management, continuity, pre-release and post-release, and eligibility and enrollment, benefit design for the initiative. We have weekly collaborations and technical assistance with our stakeholders from DOC, DCYF, facilities, MCOs, and our ACHs. Incorporating feedback from our partners, we prioritized and implemented 2 main initiatives. First, we published policy and operations guide, and it's a comprehensive written manual that really outlines the various program requirements to in detail to make sure that there's clarity and understanding for all people involved. Secondly, we conducted a learning webinar series, and these webinars covered key topics and provided valuable insights into fulfilling the requirements of the initiative. So the learning series included sessions on contracting and credentialing, provider enrollment, eligibility, and benefits as well. But after launch, we conducted rapid response calls mainly to check with those facilities that launched, to check for overall system issues and to provide technical assistance to facilities to assist with their launch. But we've been having rapid response calls with those facilities, and the purpose of the call again was to respond to emerging systemic issues that may be out there or questions that they may have. And I'm proud to say that those have gone well. Facilities ask great questions, and they have been present with us all the way. And so those that have been participating in those calls included our SMEs here at the HCA, our SMEs at the WASPIC, and also with the MCOs and ACHs who've been part of those calls. So that's been really, really good. And then one other thing that I would say is that HCA contracted with Community Health Partnership Services, or CHPS, to be our third-party administrator. And so the purpose of the third-party administrator really is to provide technical assistance and administrative assistance to facilities, also to act as a claims clearinghouse to assist with reentry services, billing and claiming, and so providing technical assistance overall. And so I'll close my part of this discussion with the announcement. Washington State Healthcare Authority is honored to receive, and we have received the National Association of Medicaid Directors, NAMD or NAMD, a Spotlight Award for its reentry work. And this national recognition highlights HCA's leadership in development, implementing Medicaid services that support justice-involved individuals as they transition from correctional facilities back into the community. But the award, I think, overall just underscores the success of HCA's collaborative approach. Again, this would not have been possible without our managed care organizations, without WASPIC, without the correctional facilities, the community-based organizations. And so a big, I would say, round of applause across all sections, really, to get this up and running. So the award underscores the success of our collaboration, and it shines a spotlight on how the state is really advancing whole person care and reducing gaps in services. So with that said, I will now pass it over to Matt for his portion on HRS and services. Thanks, everyone.
Thank you so much, Tyron. Hi, everybody. Welcome. Good morning. Matt Christie here, and I'm the Health Related Social Needs Manager at the Healthcare Authority, working on the development and assisting teams across Healthcare Authority and our partners at Department of Social and Health Services to design and implement and launch these health-related social needs services. For those of you who may not be familiar with the term, health-related social needs are social and economic needs that individuals experience that affect their ability to maintain their health and well-being. These include we address these by adding services to our waiver that include supports around employment, housing, healthy food, transportation, and so on and so forth. So we have a variety of services that we've been working on implementing since they were approved in our renewal. And actually, most recently, as of January of 2025, we received all of the final approvals we needed on the implementation plan and the services protocols, which detail what the services include, who's eligible for the services, and really hit the ground running over the course of 2025 to develop and launch some of these services. And as Emma mentioned earlier, continue to work on the design and implementation and launch of additional services. So I'll have a few slides with an overview of the services. I'll share briefly what's included, who's eligible. And as you can see on this slide, for example, for our two services that have launched, you have the launch date. The second box is how someone would access where the service is being offered. And then the bottom box is who's eligible for that service. So, coming again from the focus of this is our Medicaid transformation waiver. These services are targeted services for certain Apple Health clients. And the first is our community care hubs, which is offered through the Accountable Communities of Health across the state. There are 9 community care hubs, and we're currently working to develop one native hub that will support the state more broadly. But the community care hubs are responsible for screening and referrals for health-related social needs services. It's often called social care support services or the community hub service, as we'll refer to it. And the community care hubs work across the state within each region to work with community partners, develop infrastructure, and create pathways to access different types of supports, often whether you're on Medicaid or not. But for our Medicaid waiver, we're actually able to pay for screening and referring to these new services for individuals who engage with the hub in each region. And that launched back in July of 2024. And we have been working with the Accountable Communities of Health to really grow and develop that program as we bring more of these health-related social needs services online. The second service that launched July 1st of this year is our medical respite care benefit. And what that service is, for those of you who might not be familiar with it, it's referred to as post-hospitalization recuperative care, which really means if you are a homeless individual and you've had a recent stay in a hospital, for example, and you may, for example, had a surgery, but no longer meet the clinical criteria for staying in that hospital, we're able to pay for a place and recuperative care supports for that individual to recover in the community, even if they are unhoused. And it's a really cool service. I believe we have 12 providers across the state and counting, working to provide these services, contracting with our managed care partners across the state. So it's very much launched and up and running, and we're continuing to grow the provider network. We're developing a provider map, and I think more information can be found on our website for this service. We can drop a few links in the chat. And I will ask Takina to move to the next slide so we can talk about a few upcoming services. On the housing side, specifically, we've been working on the development of a service that's called Housing Transition Navigation. And what that is, for those of you who are familiar with foundational community supports, that's our long-term, our standing support service that helps someone find and maintain their housing. The Housing Transition Navigation Service really pairs with that to provide sort of the financial supports to pay for things like first month's rent, application fees, deposits, and the types of costs that occur when someone's looking to establish a household. We've been working on a state-funded version of this program for several years now called the Transition Assistance Program. And what this waiver is allowing us to do is really expand the amount and types of supports for individuals who are enrolled in foundational community supports with our Medicaid funding. So we're currently working on kind of the final steps of getting this service ready to launch. I understand that it will launch early 2026, and we'll have more information and probably some specific announcements that either go out through Gov Delivery and some webinars from the team that's working on that early next year as the program launches. We're really excited. It's come a long way since we sort of first conceived of this concept when we applied for our waiver renewal back in 2022 and 2023. So really excited, as I've mentioned. And following shortly thereafter is the rent and temporary housing benefit that will be available through a few different partners for individuals who are homeless experiencing behavioral health conditions, chronic health conditions, and long-term care needs. We're able to provide up to 6 months of rental assistance, so very time-limited rental assistance, and the state's being very intentional about how we pair this with longer-term supports for those who need longer-term supports, and looking at different state and federal funded permanent housing vouchers to really pair this type of support with. On the Healthcare Authority side, we are looking to launch this early 2026. It's an estimate, as I mentioned, so things might shift a little bit, but we are working with WellPoint Washington, who administers the Foundational Community Supports Program, and the Spokane Housing Authority to implement this benefit. Our partners at the Department of Social and Health Services have launched this service for certain clients who are eligible for long-term care, and that launched back in February of 2025. And so following sort of a very similar model, working with the Spokane Housing Authority as well. So really excited to be working on the final steps to launch these two services. Next slide, please. In addition to those housing supports and the services that launched earlier in 2024 and 25, we are continuing to develop and add additional supports for nutrition, caregiver respite, and home accessibility, remediation, and adaptation services, partnering with the Department of Social and Health Services to really leverage their expertise in these fields and partner with the area agencies on aging and the developmental disabilities community services, really coming from an array of experience across these different networks of providing different types of nutrition supports, home modifications, through different Medicaid waivers, and really now with the health-related social needs services under our 1115 waiver, we're really truly able to expand the reach and the types of supports that we're providing. And all three of these services we've been working on with DSHS over the last, I would say, almost, really over a year now on how these will be offered, who will provide the services, and how people can access them. They have not launched yet, but early 2026, we will see these services starting to roll out across the state, offered again through providers contracted with the area agencies on aging, as well as developmental disability contracted providers to provide these supports. And we have more information coming on the different eligibility pathways that we can share in the chat for more links to refer to these and the types of supports that are offered. So I just highlight nutrition supports can cover things like medically tailored meals, short-term grocery and pantry stocking, and nutrition education services. Caregiver respite is a really cool benefit that offers support for unpaid care and kind of relief for unpaid caregivers for individuals who require near to full-time care, whether it's due to needs of assistance with activities of daily living, long-term care needs, or significant behavioral health conditions that require that near to constant supervision. So being able to pay for support to relieve their unpaid caregiver to avoid placement in institutional settings or higher cost healthcare settings. And then our home accessibility, remediation, and adaptation services are really expanding the types of supports that people can access to maintain healthy living in their home. So these are types of supports around, accessibility modifications, could be wheelchair threshold ramps, ADA compliant modifications for bathroom safety, and then remediation services are things like mold removal, carpet replacement, mold abatement, and things like that. So really excited to be offering these, or developing these services that will be available soon. Next slide, please. And just a few key takeaways from this work. So we're really dedicated to working with Department of Social and Health Services on collaborating the best way to implement these services and supports across the state. And we're working to expand the types of supports and the services that are available. So one of the big successes is we're creating new services, we're launching new services and making them available for certain eligible Apple Health populations. And we're really working on developing new infrastructure and new pathways and new partnerships to provide these non-medical or non-medical services that help address whole person health. And the opportunities in front of us, building infrastructure takes time, careful planning, and strong communication across multiple service delivery systems. I've mentioned the accountable communities of health, managed care, long-term care, and all of these systems working together to develop and implement these new services. I think that is the end of my portion, and I'm to hand it back over to Emma for additional MTP program updates. Thanks, everybody.
Thank you, Matt. So I'm just going to talk a little bit more about two additional programs. Next slide, please. So just wanted to talk a little bit about our CIE program. So the goal for this program is to support data sharing across health and social care settings, really to support integrated care for our clients. And then we really want to improve our delivery of HRSN services by using this technology. And so over the next couple of years, our goal is to engage the community in establishing governance for HRSN data exchange. So working with community partners to understand what do they need out of this technology, and then really set up our state-supported CIE technology, again, through community co-design, launch the technology, and then really be able to onboard it and use it in the community. So we've made a lot of progress over the last year. We had a competitive procurement process and awarded a procurement to Co-Imagine Health as our lead organization. And so they will be doing work over the next many years, working with community to gather input on what the CIE technology should include, what our governance structure should look like. This will include a number of different work groups, and then we'll be able to finalize our governance structure and really launch that technology and be able to use it for our HRSN services and sharing information about our clients across service providers. Next slide, please. And then we also have our contingency management program. So what is contingency management? It's an evidence-based behavioral health intervention program for substance use disorder. And it really includes a number of monetary incentives for meeting treatment goals for our clients. And the goal is to implement via behavioral health partners across the state, where we've partnered with WSU to provide training and support for our providers. And then over 2025, we launched an application process for providers to apply to participate. We've selected a number of providers, and then over the next year, we will be launching this program and then also selecting additional providers to participate in new cohorts. Next slide, please. And I think I'm turning it back over to Kaylee.
Thanks, Emma. Appreciate it. All right, we went through all those updates really efficiently, so we're going to have some nice time for Q&A. Before we do that, we just want to take a look ahead to what's coming in 2026. I think you already heard both from Tyron and Matt and Emma about some of the things that we're looking forward to already. Some of those key things being the launch of more health-related social needs services in 2026 in partnership with DSHS, as well as really thinking about how do we make sure we're reaching as broad a population as we can. We've seen some good questions come through in the chat about, are my patients, are my clients eligible for these services? How do we access these? So we know we have ever more work that we can do to coordinate these services in the system to really try to expand that access while these services are available under the waiver. So that's going to be a big priority for us in 2026 to really improve the reach of those services as well as lift those new HRSN services in 2026. You also heard from Tyron that we have some additional carceral facilities that will launch in that voluntary reentry initiative program in 2026, including some from Department of Corrections and DCYF. So that's wonderful news. And again, just continued improvements in those services and connections both to community partners as well as to the more traditional healthcare delivery system. So, in addition, as we start to look ahead to 2028, when MTP 2.0 will end, the current iteration of our waiver ends. These 1115 waivers, like Emma mentioned at the top of our time together, are really intended to test, to demonstrate some new and innovative interventions in the Medicaid program. And so we'll be doing a lot of ongoing work to gather data to really help understand how effective are these interventions and try to build up an evidence base to support continuing those interventions that are most effective into either a future iteration of a waiver, into other types of waivers, or even, if appropriate and pending the availability of funds, into our state plan amendment as Medicaid benefits more permanently. So really looking to build up those evaluation activities leading us towards the end of this current waiver intervention. I saw a great question in the chat about HR1 and some of the other federal policies that are coming into play. I should note the waiver itself, there's no immediate impact of any changes that have happened at the federal level on our plan or what we're allowed to do under existing waiver. We have a contract with CMS. We have an existing plan for what happens for the rest of the waiver, and that goes forward. We do certainly know from some releases that the administration has put forward about programs that will definitely end at the end of this waiver. Emma mentioned one of those at the top of the hour. Part of our waiver program now is continuous eligibility for children. As well as some other populations. And CMS has said that that will end at the end of our waiver, and we need to start planning for the end of that and put those clients back on, the regularly scheduled Medicaid eligibility review schedule. So we know that there's going to be some changes coming. And of course, while this team, the waiver folks, are not directly implicated in the implementation of HR1 or some of these other federal policies, of course, they're going to have an impact on our programs. A couple of years from now, as we see in 2027, HCA has to implement the community engagement requirements, also known as work requirements in Medicaid for that adult Medicaid population, that there will be opportunities for us to really use our waiver tools to try to mitigate some of those impacts. So as we know, there are exemptions for medically frail individuals. We also know that there are exemptions for other types of conditions that could be eligible. And I should say, we know that. we think we know that from what we've heard from CMS so far, but we're still waiting for detailed implementation and guidance from them about that. So we are staying in close touch with the rest of our healthcare authority partners who are implementing HR1 to really think about how do we share data? How do we try to maximize the programs that we have that can help to ease some implementation of these? And last but not least, looking ahead, June 30, 2028 marks the end of the Medicaid Transformation Project 2.0. We know that there's going to be some big changes ahead for us. I already mentioned the definite end of one of our components of the waiver that CMS has announced. We also know that there's some headwinds for some of the other programs based on the administration's position, based on that they've rescinded some guidance, particularly for health-related social needs services that the Biden administration had put into place. So we are starting to look at that. We're starting to do an assessment of what's going to be possible. We also know that one of the primary funding mechanisms that we have for our current waiver is going away. So a lot of big changes that are ahead, and we're going in 2026 to really start doing some disciplined planning and engagement of stakeholders and community members about what the future of our waiver should look like. What are the programs that are effective? What are the needs of our communities and stakeholders in this rapidly changing environment in the coming years? So stay tuned. We really do need your continued engagement and support. I know Lindsay has been dropping a lot of resources into the chat. Our Medicaid Transformation Project website is a great way to stay in touch with our activities, with what's going on. And when we do get to the point of some of those engagement opportunities around planning for the next iteration of the waiver, those will certainly be posted there, and we'll be really transparent about what those opportunities look like. So with that, we have roughly 15 to 20 minutes for some Q&A, and Lindsay and Ed are going to facilitate that.
All right. Thanks, Kaylee. Thank you, everyone. Great presentation. As you can see, a lot of amazing work happening this year. We have been very busy. And as a reminder, okay, we're going to go through the Q&A. There is a Q&A feature at the bottom. Just click that icon and the Q&A will pop up. There's 3 tabs across the top. There's open, answered, and dismissed. We have not dismissed any, but if you did ask a question and you're wondering where it went, it could be under the answered. So, for example, I see Stacy asked, how are you measuring these programs as successful? And so Emma answered that there. We have an evaluation produced by, let me get it, Oregon Health and Science University. They have an evaluation team. So some of those answers are in there, but let's get to the open questions. And I'm going to try to go in order and punt to the team members that I think can answer it. We're going to start with medical respite. Matt, we've got a couple of questions there. Can you assist with, we're wondering when the medical respite provider list map will be posted? I know we've talked about that.
Absolutely. So we are working on developing and creating the map. There's quite a bit of work that goes into these public facing, I guess they're called dashboards, but they appear as a map, similar to what we have, and I'll probably post them for a few future questions, but for the housing programs that we have. But I understand early 2026 that link will be made available to the public. So currently underway. I don't have an exact date, but we have our subject matter experts and our data teams working on creating that public map/dashboard for medical respite. And we'll be sharing that out through a variety of pathways, managed care organizations, accountable communities of health, our website, GovDelivery, so everyone will have access to that.
Okay, Matt, don't go anywhere. We also are wondering residents eligible for up to 6 months rental assistance and the first month's rent and deposits. And that's at a sober living. This is from a sober living home operator wondering about that. If
Yes,
you're, yeah, go
great
ahead.
question. Yeah, happy to answer that. So, I'll first start by saying it's not so much a question about location or type of housing. It's really individual eligibility for these benefits. So if an individual qualifies for the HRSN housing supports, they could receive up to 6 months of rent total. So we're not able to combine that 6 months of rent and first month's rent. It would be 6 months total. So it depends on how, again, individual eligibility criteria. Do they meet the social and clinical risk factors for that service? And then it would be a question of the referral pathway. So currently, we're able to offer those services. Well, they have not yet launched, but when they do launch, they will be offered through foundational community supports to access those services. Hopefully, that helps answer that question.
Yep, and the next one's yours too. And is there a waiting list for the services related to community living? How are cuts that are outlined in the federal budget? I mean, this is a big question going to impact the availability of these services. Two separate questions there. What about the waiting lists?
We don't currently have any waiting lists for our supportive housing benefit. We do always have that ability to implement one. However, I think some of you may be familiar with pausing new enrollments to the Foundational Community Supports program that happened back in 2024. So that situation could arise in the future. I'm not saying it will. It's just based on the terms of our waiver, we are able to implement wait lists if we um, are coming up against our budget. So that's uh, always a possibility, but currently there are no wait lists for our supportive housing benefit, if I understand the question correctly.
I think so. And then Kaylee, did you want to pop on? I think you sort of already answered the part two there of that question just about the federal budget and our services.
Yeah, that's right. So it's important to note that HR1 policies they sort of go into effect over a period of time. So it's not like when it was signed into law on July 4, everything is live. There's a rolling schedule for when these policies go live. So that's part A of this. Part B of this is that, again, like I said, we do have an existing waiver approval that has not changed. That existing waiver approval goes through June 30, 2028. And all of our current programs, even the ones that we know HR1 or other executive orders might impact, we can continue to implement our existing waiver program authority as planned. So, not currently impacted, except, of course, as some of those programs and policies roll into place over the next few years and say impact enrollment. A lot of our the services that we talked about today are available to Medicaid enrollees. So if someone no longer is eligible for Medicaid, then of course they're no longer eligible for some of the services that we talked about today.
Thank you. All right, I'm going in order, and we got a couple questions about contingency management. Emma spoke to that, but I'm actually going to bring on someone else. Sonia, are you available to speak to a couple questions? We're wondering how management services, how someone can apply for those services as a provider.
Hi, everyone. This is Sonia Wagner. So we will be sending a message via Gov Delivery and in January, sometime in January. We haven't decided on a firm date yet, but just keep an eye out on Gov Delivery and you'll get some information about contingency management and also an application form, which is called a readiness assessment or readiness toolkit. So that is how you apply. And then we go through a review process and select providers.
All right, and someone is also wondering who are the selected providers? Is that in? I shared the fact sheet. Is that in there?
No, so what our providers, we have 20 providers going through the contracting process. And once we've wrapped that up, we will publish who the providers are. I don't have a firm date on that either, only because the contract process will vary depending on the provider, but just know that we will eventually, once the contracting process is over, we will publish that information.
All right. Thank you, Sonia. Thanks for popping on here and answering these questions. Let's see. We are also noticing I'm getting some messages that people are having trouble copying the links in the chat. We're working on that from the back end. I'm going to try one thing real quick, which is I will paste the entire presentation in the Q&A. I wonder if you would be able to try that. So from the presentation, there are also active links in that. but I guess this in itself is also a link. So this, um, oh, I can't ask a question because I'm a panelist. All right. So a little technical difficulties here. We're really sorry. We're trying to get this figured out for you. We've only got about 10 minutes, so let me see. Um, let's see, I've got another question, and this is about FCS. So Matt, I think I'm going to go back to you. Will you be adding more providers to the FCS program? Can you answer that, Matt?
I can answer that. That's a great question. So we're always looking to add providers to the Foundational Community Supports Service Network. We have a few resources on our website, and I can drop those into the chat. I understand we're having a challenge with links right now, but we have a specific provider inquiry form and a provider application form to fill out and submit to the Healthcare Authority to initiate that process. I'll
Perfect.
provide
Thank
those
you.
links. Yep.
Um, we're also not really sure about the next question, so I'm going to move over while we try to figure that out. Kaylee, someone's asking about the work requirements. I'm not sure if you touched on that. Do you want to say anything more for the work requirements for HR1?
I think we've covered that already.
Okay.
Yep.
Okay, thanks. All right, let's see. We've got a question. Sorry, y'all. We were asking some great questions. We're trying to get through them all. And I'm seeing a lot about the links not working. We're so sorry. Um,
Lindsay, I think we should be able to, we can download the list of attendees and we'll send out afterwards to all attendees the list of links. And like Lindsay mentioned, that this whole presentation is posted on our MTP website and it has those active links embedded in there too. So we will follow up with that list after the meeting today.
Okay, thanks, Kaylee. Sorry, I'm multitasking and trying to get through these. I do see another good question, Matt. It's going to go back to you. Lots of really great questions about our rent and housing services. So Stacy's asking back to the 6 months rent and or first deposit. If our residents signed up for FCS, how do they apply for the rental assistance?
It's a great question. It be initiated through their contracted FCS provider, so the provider they're receiving supports through. I understand that sort of eligibility determination process will occur at WellPoint, um, but I don't know all of the details yet as to what that screening looks like. I'll just mention there's not an apples to apples comparison between FCS eligibility and the HRSN eligibility. So it depends on how they were determined eligible for the FCS program and what specifically risk factors they meet. So more information to come. I will just suggest, and I can provide some contact information to the FCS program staff to answer some more of those questions if that's helpful.
All right, that'd be great. And I'm seeing some more specific questions. So if there is a personal question or something directly related to you, we will get in touch with you. We've got emails for people who have joined today. I do see a question about Gov Delivery. That is our email platform that we use. I would share the link for how you subscribe, but that doesn't seem to be working. So we will email attendees with all of the links. Included in that will be how you sign up for um, it's really for the whole healthcare authority, but we do have a specific listserv that we use through Gov Delivery that we send our MTP announcements. So we'll give that to you as well. Let me see here. We've got a question. How should providers reach out to state agencies about participating in MTP? Emma, do you want to take that? That kind of covers all of MTP. There's a lot of different answers, I think.
Sure. So I would just quickly say that it is typically, well, that can happen in a couple of different ways. Depending on the program, there often is a separate work group of providers that provide a service, and we have HCA or our affiliate sister agency partners working with that work group. We sometimes do outreach via Gov Delivery, so I would recommend that folks who are not signed up for Gov Delivery do go ahead and get signed up for waiver related updates. And then we push out information to providers about participating in our different services that way. And then, I mean, I think at the end of the day, providers need to meet criteria to be able to participate as a service delivery partner. And there's more information on our website and yes, via our different work groups. So kind of a multi-part answer there. But if you have any questions, please just reach out to our inbox and we can get you connected and talk about a specific situation.
Thanks, Emma. A lot of questions, Kaylee. I'm going to come back to you. A lot of questions about the renewal and looking to the future. So, wondering about if CMS did rescind allowances for the HRSM services, how will this work for Washington in the future?
Yeah, great question, and one that is certainly top of mind for all of us too. So, I want to get really clear about that guidance that was rescinded. So, under the Biden administration, CMS put out some guidance, guidelines, really a framework for how states that were interested in putting health-related social needs services into their waivers or their Medicaid programs, how could they go about doing that? So it was really a checklist of things that they had worked out with the first couple of states that put that forward. So they put out this general guidance for how that would work. And the new administration rescinded that guidance. So they haven't necessarily said, absolutely not, no way, we will never do these services in a waiver program going forward. They just took away that guidance and said, we're going to be super skeptical of these programs, and on a one-on-one basis, we're going to figure out if this is something that we're willing to consider in waiver programs. So like I had mentioned in some of my comments, major headwinds that we anticipate for the health-related social needs services. So that said, there are some pathways that we could consider. For example, some of the housing-related services. There are other types of waivers that the state could consider and that we are going to look into, home and community-based service waivers, that we could potentially continue some of those services. I think there's also a lot of interest in CMS in nutrition-related programs. We've heard that interest from CMS leadership, from other folks at CMS. There is a little bit more of a buy-in about the potential of nutrition programs as continued benefits. There are a couple of states that will be renegotiating their health-related social need waivers with CMS before we get to ours in 2028. So we'll be watching those states really closely for how CMS responds. I saw there was another related question about, sustainability of our programs. Of course, we're looking into this and we don't have good answers yet. This is going to be an ongoing conversation for the next 18 months to 2 years, really, about what one of our programs are really functional, are really delivering value to our clients in the state, and what can we sustain with budget measures. And yes, of course, we are looking at other innovative ways that we could fund some of those measures going forward.
Thank you, Kaylee. We are at the top of the hour. Just sort of one last question, Kaylee, I think just relates to all this, and we will have to wrap it up. Somebody's asking what office or division at HCA is working on the HR1 work requirements. I think this is coming from the top down senior leadership, but maybe just let everyone know, how HCA is addressing all of these changes.
There's going to be multiple divisions that are involved in that because so much of the impact has a broad reach, including our technical IT systems, our eligibility system. We will have more information about those work requirements, community engagement, and how we're going to engage the state's community organizations through an ambassador type program. We know folks are really eager to get involved and know how they can help with that. So, long answer to a very complicated question, but just stay tuned. More is coming on that as more guidance comes out from CMS.
Thanks, Kaylee. All right. Thank you, everyone, for all the great questions, for taking an hour out of your day and spending it with us. We are going to get to the bottom of the link issue and make sure that we can send those to you and give you all this great information. So thanks again for joining us. I hope you all have a good day, and we'll talk to you again. Thanks.